Hi, I'm Dr. Tracy Sands with Healing Paws Veterinary Care, and I'm here to talk to you today about vaccinations in puppies in the Mid-Atlantic region of the United States. This may vary from other areas. Vaccinations in puppies are one of the most important gifts you can give your friend. And I know that there's a ton of information out there about what is right and what is wrong with vaccines. The information that we need to trust is the studies that show that these vaccinations that we are going to talk about protect your puppy from potentially deadly disease. So today I want to talk about the vaccines. I want you to know that you need to have a discussion with your veterinarian about the best personalized plan for your puppy. I'm going to teach you what the vaccines are for briefly and say to your veterinarian, I want to protect my puppy for our personal situation, and they're going to help you navigate that. At the end of the day, what we want is to keep your puppy free from disease, and you're going to hear to keep your family free from disease as well. So here are some vaccinations that we recommend for puppies. For the respiratory system, that's your nose and your lungs, we have kennel cough and influenza. Now, many folks have heard about kennel cough. The kennel cough vaccine actually covers 1 to 2 different types of problems that can cause a cough when you're in a situation with a lot of puppies. Many clients think that if you get a kennel cough vaccine, you'll never have a virus with a cough. That's not true. Just like the common cold, there can be many different causes of kennel cough. Kennel cough vaccine is most frequently Bordetella. It can be injectable, it can be oral, or it can be placed in the nose with an applicator. That vaccine is recommended for puppies who are going to spend time with other puppies. That's all of the puppies, as we all want to get our puppies out and socialize them. Respiratory germs spread just like wildfire in puppies, just like in human daycare. So you want your puppy to be vaccinated for kennel cough at a young age. The second respiratory vaccine we have is influenza, the flu, the canine flu. The canine flu is like the flu in humans in that it can cause pneumonia, and that pneumonia in little puppies is deadly very quickly. It's different than the human flu in that we are blessed to only have 2 strains of canine flu, and we are also blessed that we have a very effective vaccine for both strains. We've not seen mutations. We don't have the concern like we have with the human flu. And as we all know, the human flu vaccine absolutely can reduce our symptoms and spread. The canine influenza vaccine can protect your dog from pneumonia. And as a puppy, pneumonia is very, very dangerous. If your puppy is going to be going to a groomer, to a kennel, to the pet store, to the dog park, they are at risk for kennel cough and influenza. If they travel with you and stop and use rest stops that other dogs frequent, they're even higher risk for influenza because there are hotspots in our country, different cities, different states. If your boarding kennel or groomer isn't requiring influenza, they're only requiring kennel cough, your puppy's at a higher risk for influenza. It's not about what they require. Don't ask for vaccines just because you need them to get groomed or you need them to have your dog boarded. You want to ask for vaccines to protect your pet. If your dog goes to a boarding kennel that does not require influenza, any other dog in that kennel could be carrying influenza. If your dog has a vaccine, the chances of them developing pneumonia are much less likely. So let's focus on protecting your dog rather than on the requirements for the boarding and grooming facilities. For state law, in Pennsylvania and many other states, it is required that our puppies are rabies vaccinated. Rabies is deadly. 100% of the time, rabies kills, and we have a very effective vaccine for rabies. The thing that we have to remember is rabies not only kills dogs and other animals, rabies kills people. And we don't know our animals have rabies at the time of transmission. So this is why it's state law. Even if your puppy will be a pocket pet forever, we need to make sure that we protect our dogs and each other from this deadly virus. So your puppy will be getting a rabies vaccination, and that will be boosted based on state requirements. Let's talk about some other viral diseases. So viral and tick-borne. diseases that we vaccinate for. You're going to hear the word distemper, but I'm going to write D-A-P-P. Sometimes it's D-H, doctor handwriting, D-H-L-P-P, or distemper. Well, what is the difference with all of those? Distemper is kind of slang term for this vaccination. The D is distemper. We have adenovirus, parvovirus, parainfluenza virus. Sometimes it's H because instead of adeno, we call it hepatitis. The L in the DHLPP is leptospirosis, which we'll talk about in a minute. Bottom line is your puppy needs protected from distemper, adeno, and parvoviruses. Parvoviruses, many of us are aware of, is a diarrheal virus that is very hard to treat and kills many puppies. And a vaccine series with several boosters can really protect them from death. Distemper, we used to have very commonly in our country, and it's an awful disease with respiratory symptoms, neurologic symptoms, and these vaccines reduce the spread of that disease and protect your puppy. So I mentioned leptospirosis, and leptospirosis is this nasty little creature that lives in urine, and it lives in urine of all kinds of animals: cattle, rats, mice, skunks, possums, puppies, cats. Odds are one of those things is somewhere where your puppy visits. And we know that puppies and dogs use their nose and their tongue and their mouth to check out their world. All they have to do is get a few droplets of leptospirosis infected urine into their mouth, and now they have that disease. Leptospirosis can cause kidney and liver failure, and it's also contagious to humans. So it's really important to ask your veterinarian about protecting your puppy. If you have a Weimaraner or a very small breed puppy, the veterinarian may recommend that we wait until they're a bit older to vaccinate. You're going to need to make sure you're watching where they visit. If they aren't one of those breeds or sizes, your veterinarian will definitely be recommending that leptospirosis vaccine so that we can protect your friend and you. Another vaccine that we highly recommend in our state is the Lyme disease vaccination. The Lyme vaccine is something we honestly wish we could have for people, but we've had it for dogs for decades. And in the early days, it caused some pretty sore legs, maybe didn't seem to work so well. So you might see some old data on the internet about that. But our Lyme vaccinations over the last 10 years have been amazing. They are recombinant, so they're pure vaccines without extras, and they protect. The level of Lyme disease cases that I've diagnosed since the vaccines have come around has dropped dramatically, and it's so exciting. The pets don't have soreness at their injection site, and we can take away the risk of a disease that lasts with them forever. So I highly recommend Lyme vaccine, especially if you're in a state like Pennsylvania, which is at last count the #1 state for canine Lyme disease. Those are the vaccines that we discuss here in Pennsylvania. There are also some other vaccines available, like rattlesnake immunization. If you are in an area of the country where rattlesnakes are a high risk, you definitely want to talk about that with your doctor. When having your puppy vaccinated, your doctor is going to look at their age, their size, their health status, and you're going to work with your veterinarian to determine how many of those vaccines that they should have at a time. Many of these vaccines require boosters 2 to 4 weeks apart. In fact, Kennel Cough and Rabies are the only ones on this list that don't require boosters the first year. Booster vaccines are necessary because our body sees the first vaccine. Let's say it sees the first influenza vaccine and it says, that thing's not so cool. I'm going to fight it and get rid of it. I don't have to worry about it. It doesn't create lasting immunity. But then if we come back and booster that vaccine again, the body goes, whoa, I saw this thing before and it keeps coming at me. I'm going to create a line of defense. And that's when we get our lasting immunity. So that's the importance of boosters. And that's why it's important they're in a certain time period apart based on the vaccine. Because the body's going to forget and say, well, it only happened once every so often. I don't need lasting immunity. Really important in puppies. As your puppy grows to an adult, your doctor will work with you to understand how long in between those boosters. Some things like Lyme and leptospirosis, the body can only do such a good job for only a year or so. Other things like distemper, parvo, rabies, the body makes an immunity that lasts for more than a year. Some of the diseases, like distemper, you can even do a blood test to see where the body's immunity is, called a titer, before you vaccinate. Again, that's for adult dogs. Your puppies have not seen these viruses and diseases, so we must vaccinate so that their body can build an immune defense rather than their body getting sick. I hope this helps you understand what vaccines are going to be discussed with your puppy. It's really important to us at Healing Paws Veterinary Care to learn about your puppy's lifestyle and customize a plan. Make sure you ask any questions you have, and we'll be glad to help you navigate those decisions. Enjoy your puppy.